Ahí se ve.
Sí, sí lo puede hacer, lo puede poner en pantalla completa, por favor.
Ahí se ve.
Sí, ahora sí puede mostrar algunas diapositivas. Perfecto. Ya, estamos ok.
Listo, gracias.
Ya. Em, ya, de prueba de imagen y ya.
Ido a la casa y la pérdida de mi hábitat. Ahora hago parte del proyecto GCF Visión Amazonía, que confió en mí y no se dejó llevar por las apariencias. Este proyecto es financiado por el Fondo Verde del Clima, GCF en inglés, e implementado por la FAO de manera conjunta con Minambiente e IDEAM, y busca reducir la deforestación y degradación forestal en el bioma amazónico colombiano a través del fortalecimiento de las capacidades para monitorear los bosques nacionales y locales.
Sí, FAO e IDEAM son socios para fortalecer este sistema que opera desde el 2011 y suministra datos que permiten la toma de decisiones.
En el próximo capítulo podrás conocer qué información genera el sistema de monitoreo de bosques y carbono liderado por el...
Dear friends and farmers, The World Food Day 2024 theme, Right to Food for a Better Life and a Better Future. Remind us that FAO has a huge mission to ensure food security for people every day, everywhere. A better life is more and more dependent on the food diversity from different resources with different origin. Promoting food diversity can improve the protection of biodiversity and cultural diversity. Today, smallholder farmers and family farmers are the backbone to producing enough food and preserving traditional food cultures. We know that around 730 million people are facing hunger due to the global challenges caused by the man-made and natural disasters, based on the 2024 Sofia report led by FAO. And more than 2.8 billion people in the world are unable to afford a healthy diet. There is no time to lose. We must take immediate action. We must act together. This World Food Day let us renew our commitment to build a more efficient, more inclusive, more resilient, and more sustainable agri-food system that respects everyone's demands for varied and healthy food. The right to food is a basic human right. Collective action can drive in substantial change with global collaboration from all sectors and all partners, and especially the youth, because a food secure future is their right. They design and decide their future. The UN Summit of the Future will be determined by their actions. Science and innovation, including IT, AI, biotechnology, and digital agriculture, among others, will be a decisive forces for agri-food system transformation. Together, we can honor our collective pledge to take action for people, planet, and prosperity, and the four betters: better production, better nutrition, a better environment, a better life, leaving no one behind. Our actions are our future. And our actions must ensure the right to food for a better life and a better future. Happy World Food Day 2024 and happy FAO birthday to you all.
Voy a eucalipto, voy a ir a la natural. Voy a ir a plantán, peteregu, cedro.
Naranja, mi bebé. Ay, bebé, urara, urara, guachande. Mi bebé teregu, mi bebé guayaibi.
Más o menos, me costó 5 metros, ahí no eucalipto. Es natural ya, casi 1,5 metros o 2 metros, veo de
Hoy la horcalito, hoy la guayegui, mi lo ya de ha roño tu qui y mata y liño pero me ore la roño tu hangua curi y ore roño tu seante roño tu hangua roño tu suba bati. Tu chapa me na con la bati ya hi amai. Voy anda ahí, a ver anda ahí está cuidando tu pero cuando ya se imagina un mía se agüerula se va a mo pupu, cure un mía a cocinar su. Y de provecho peite con la niña pues. Un hangua así, pues un mandego a cuata ore.
La tormenta ahí mi ahí. Da, él es por ella te ya. Por la olla es juicio ya voy. Un dipaco, pues.
Upela be amatusha primero que yo la voy a batir, un gajo gapaite porque besa upea ya la voy a batir. Tu. Ha upea un gajo gapaite, ha upea tu cuipe utu. Ha upea hoy tu paite oje. Pero puta pupe que la ore naranja mío o cacua. Pero la roño tu a su primera vez a tu oñe un dipaite. No aprovecháis ni uno.
Hako año bendo ko mandi o milai pona je. Ako ko año ningo hundi paite o ini dai poi ko ni e un be uma se be vision hundi paite. Ako ko año la ya ba se uma la ba be te veranga do ubi la re ko pu be wa. Pesa mi mingo un año ma pe hapo. Oi tu paite be. Ubu tu imi o wa tu ha oi tu pa sa o jo ai po ka ndo wa le yoi. Pero ko año be ipona itere.
Sengo la wero ite a lo menos iko amore higlo men bu kwa ben wara pe naranja mi pona ite ha. Hai kwa la ore ko beta la de provecho la upe ho butu ta hinya hai kwa.
Sao que ahí la se naranja porque no se ve con la naranja mía. Ni un di pan con la uva. Un di tengo pe visión bo ho we un ba. Así que ahí te de la isano y te ingo. Y pon ahí te ingo. Ojalá con la apona ore de hija. Y pon ahí te ingo, y pon ahí te ahí. Se me busco a ver ente te a más. Ahí te se la a putu a la.
Esperanza me mete si la en familia vengo ante tengo llamapo.
Es un principio universal de la vida, un derecho humano fundamental. Todos deberíamos tener acceso a alimentos suficientes, nutritivos, diversos, asequibles e inocuos. Comienza en la naturaleza, un viaje de nuestras granjas a nuestras mesas, donde nos reunimos para celebrar nuestras identidades culturales. Día Mundial de la Alimentación. La alimentación es un derecho, todos los días, para todos y en cualquier lugar.
El cambio climático está transformando los paisajes y las vidas de millones de personas en todo el mundo. Las comunidades locales que dependen directamente de la naturaleza son especialmente vulnerables. Chile, a través de la Ley Marco de Cambio Climático, reconoció la necesidad urgente de adaptarse y mitigar los efectos del cambio climático en las áreas más afectadas. Así nace el proyecto Acción Territorio y Clima, diseñado para abordar las consecuencias del cambio climático y apoyar a los gobiernos locales y sus comunidades en la gestión sostenible de sus recursos. El objetivo de esta iniciativa es capacitar a los funcionarios locales y organizaciones ambientales en prácticas sostenibles para la adaptación y la mitigación del cambio climático. Así lo estamos haciendo en las regiones del Maule y del Biobío, en diferentes localidades, empoderando a las personas con conocimientos y herramientas para construir planes regionales y comunales de acción por el clima. A través de talleres, formación y fortalecimiento de capacidades, se promueve un desarrollo local integrado, resiliente y sostenible. La experiencia se centra en proporcionar soluciones prácticas y adaptadas a las realidades locales, garantizando que las comunidades puedan prosperar a pesar de los desafíos climáticos. Trabajando mano a mano con los gobiernos y comunidades locales, enfrentamos juntos las consecuencias del cambio climático, construyendo un futuro más sostenible para todas y todos.
Child has a right to food. Raise your voice for a better life and future. For a better life and future. Tienes derecho a la alimentación. Alza tu voz por una vida y futuro mejores. Por una vida y futuro mejores.
Tell me why kids go to sleep hungry. We got a right to eat no matter what country. Pourquoi la famine est-elle aux infos? Ça n'a pas de sens. Ce monde a assez de nourriture.
为何还会有人饥饿？这世界本不该有饥寒交迫。
Porque el dolor y el conflicto
Es absurdo que no avancemos.
А как же катаклизм грозится нам бедой? Неравенством фашизм приносит он порой.
ليه الجوع لسه موجود مع اننا بنتحدى بقالنا سنين.
Porque do campo ao prato nosso sistema alimentar non è sicuro. Perché il mondo non può stare in pace, non si può controllare come o quando mangiare.
Știu că în fond o să vii mânte, fentăm taua, tu am bine nu venim mehr, tu am bine nu venim mehr。每个孩子都要成长，伸出手，共建美好生活与未来，共建美好生活与未来。
De la semilla al fruto, un ciclo vital. L'alimentazione è un derecho, una necesidad.
Такой же ясный ум, навыки, знания, зажгут тебе героя здорового питания.
Innovare, mantenendo tradizione. Più verde il pianeta, aria e vita migliore. Give a helping hand, even just a little bit. Stay informed, become a label literate.
Escolhe bem, reduz o desperdício, educa a comunidade, melhora o mundo de verdade.
C'est facile, c'est la mission. Des aliments abordables et de bonne nutrition.
许下美好的心愿，坚信着现实会发生改变。
مش عايزين املنا يروح فبنعلي صوتنا ونقول
Let's go! Дети не должны знать боль и голод. Так сделай шаг. Победа за право на питание. Победа за право на питание.
كل طفل ليه حق يتغذى فعلي صوتك لحياة ومستقبل أحلى لحياة ومستقبل أحلى.
Every child has a right to food. Raise your voice for a better life and future. For a better life and future.
El Equipo para el Fortalecimiento de las Capacidades y Desarrollo de las Oficinas, COTS, por sus siglas en inglés, es una iniciativa clave en nuestra nueva estructura estratégica de la FAO en la región. Nuestro objetivo es proporcionar asistencia inmediata y efectiva a las oficinas de los países en aspectos operativos y funcionales, asegurando una respuesta ágil a las necesidades, contribuyendo así al desarrollo de capacidades y a la gestión del conocimiento. Para atender a las oficinas de los 33 países y a la implementación de proyectos, hemos desarrollado herramientas de gestión innovadoras, OnTrack, Smarts y el chat de campo, creadas para mejorar la eficiencia de nuestros procesos y garantizar la transparencia y trazabilidad de nuestras operaciones. OnTrack permite un seguimiento sistemático de la implementación de proyectos, monitoreando tiempos, entregas y ejecución presupuestaria de manera estandarizada, garantizando así la seguridad de la información y facilitando un repositorio único de registro y respaldo documental. Smarts brinda soporte a la gestión de fichas técnicas para la adquisición de bienes, estandarizando y automatizando el proceso de aprobación. Mejora la eficiencia en términos de tiempo y costos. Smarts tiene más de 4.000 fichas técnicas sistematizadas. Chat de campo, elaborada con apoyo de FAO Campus, utiliza inteligencia artificial para agilizar el soporte a las oficinas, respondiendo automáticamente a preguntas frecuentes. Además, busca mejorar la eficiencia del soporte y agilizar el tiempo de respuesta a las oficinas. Estas iniciativas han transformado las actividades operativas, garantizando una gestión óptima de recursos y logrando resultados significativos en la implementación de los programas nacionales.
Bueno, muy buenos días a todos, allá donde se encuentren, si están conectados, si están en el webinario Resistencia
Good morning,
Antimicrobianos.
everyone. You are joining us here today at the webinar entitled Antimicrobial Resistance, Educating and Promoting Globally. I am Mr. Winter. I will moderate this webinar, and we have three specialists from the region joining us here today. So I would like to greet you all and thank you for joining us. This streaming is being carried out through YouTube. You can choose your language, English or Spanish, using the toolbar on the screen. We would also like to ask you to use hashtag #OneHealth, hashtag RAM, or better production to share this on your social media websites. Now, some context for you. It's clear that antimicrobial resistance is a global priority given the ongoing threats such as the pandemic, and these call for multi-sectoral intervention at all the levels and in all the countries. Therefore, today's program includes three guest speakers who will refer to global and local aspects with concrete messages with regard to what you can all do from your place and within your position in order to foster contention and containment. First of all, allow me to give the floor to Alicia Gallardo, a fishing specialist from the LAC region. She will refer to the global framework for antimicrobial resistance. Alicia, the floor is yours, and thank you for joining us. Good morning. Thank you, Nicolas. Good afternoon. For me, it's a pleasure to be here. Let me share my screen with you.
Bien. Bueno, justamente es muy importante, estamos en la semana de la
Very important to remind you that this is the week regarding awareness, regarding antibiotics. And so we are here to provide you with a message with regard to antimicrobial resistance. Now, this motto that is the title of this presentation is the model that was chosen for this year, and it's educate, promote, and act now. I really like this because this is a call to action, and at the same time, it ties into the event today. Now, with this, it's important to mention that antimicrobial resistance within the framework of One Health, and we will talk about global frameworks, is key. But first, we need to begin by defining One Health that goes back to 2022 as something that is unifying and integrating between human health, animal health, and ecosystem health. And what's important here with regard to this approach and this driver for those of us who work in agri-food systems is that it addresses the need for food, water, or our need to have food, water, healthy air, and healthy plants, all within this concept of sustainable agriculture. So with regard to the Global One Health Action Plan, in 2015, international organizations pull together under a global framework to work together for human health, animal health, plant health, and the environment's health. As a result, within this global One Health frame of action, one of the key components is antimicrobial resistance. As Nicolas mentioned, this constitutes a relevant threat. It's a silent pandemic for global health and for economic stability, since this has an impact on human, animal, and plant health. Moreover, antimicrobial resistance makes medication that is crucial for saving lives ineffective. Therefore, it is a need with regard to the need to have more international collaboration. Therefore, under the auspices of the One Health Plan, the Global Action Plan for Antimicrobial Resistance was adopted, and beginning in 2015, the countries received guidelines in order to establish at the national level a plan called the National Action Plan, whose main objective is to mitigate AMR. Now, we were all quite pleased to see that from 2015 to 2022, the three bodies related to AMR and the One Health framework to form what we call the quadripartite partnership. In other words, 4 international organizations that are tied to agri-food systems, such as FAO, got together. Now, FAO is organizing this event today, along with the World Health Organization, and the World Organization for Animal Health also was involved. And in 2022, the UN Environment Program joined forces as well. Therefore, now we have 4 organizations that collaboratively work together at the international level as an orchestra. I like that word because I heard that once from an FAO colleague. So the 4 organizations work together to orchestrate a concrete plan involving national actions to address antimicrobial resistance. So these national action plans make up the implementing unit, the structural unit, one could say, within each country, in which governments define sectoral governance mechanisms and concrete actions. So the objectives of the national action plans are several. One would be to improve awareness and understanding with regard to AMR, and this involves communication, education, and effective training. And the second main objective is to reinforce knowledge and tests by way of surveillance and research. We know that the AMR process is quite challenging, and there are still gaps regarding research. And this is particularly at the interface level between humans and animals and the environment. And the third objective of the national action plans clearly is prevention, prevention, prevention. In other words, to reduce the incidence of infections at the human level and at the animal level, land and marine animals alike. The fourth objective related to the use of antimicrobial elements is to optimize the use of antimicrobial medication for human health and animal health. And then finally, these plans clearly need funding. Therefore, it is also the responsibility of the governing entities in the countries to establish mechanisms that will allow for raising funds and financing to ensure that the plans are sustainable. Because in the end, the plan is the key national tool allowing countries to move forward with AMR. And in fact, some countries have already gone through 2 periods. Some are already wrapping up their second period. So in the end, the sustainability of these plans is key in order to appropriately address this silent pandemic. What are some of the outcomes that we have had thus far since the international collaborative efforts have been carried out and since we have this framework for AMR? So far, 159 countries have developed multi-sectoral mechanisms of governance and coordination applicable to ARM. In other words, the human health, animal health, agricultural, fisheries sector, and other sectors have joint efforts to address these aspects. And also, in keeping with recommendations by the UN General Assembly and the quadripartite partnership, there are several different activities being carried out. For example, countries have moved forward with surveillance or research, prevention, and infection control. Moreover, a variety of stakeholders have become more engaged. For example, some actions have been focused on farmers and the public at large. Now, this quadripartite partnership has a website, and they refer to the progress made with these plans. Now, despite the progress, there are still significant challenges regarding the plan's implementation. And of course, the plans have a variety of different components that are region-specific. In some regions, the plans have not made the expected progress in keeping with the One Health Global Action Plan for AMR, and we have seen that it's the lower income countries where these plans have not moved according to expectations. And there's another issue, and that is the lack of financing. Often, a lack of financing prevents measures from being implemented in the sectors that are not related to human health, that is the animal health and the agri-food sectors. Therefore, this perhaps is the most relevant challenge, an obstacle that the countries face today with regard to implementing their national plans over the past few years and the upcoming years. If you go into the global database related to AMR, you will find the findings of the self-assessments carried out by each country annually. This information is available, dating back to 2021, and the information is available in English. Actually, dating back to 2023, you will see that there are 4 components of the action plan. And you can also see how the countries self-assess their situation with regard to human health, and that is primarily related to monitoring resistance and use of antibiotics and antimicrobial medication, excuse me. And then the second component is animal health, land and aquatic or marine animals. The third component is food and agriculture, which is primarily related to the activities that FAO carries out in the region. And the fourth component is the environment. I would like to invite you to search the status of each country or conduct a regional assessment, which of course is very interesting for all of us so that we may have some food for thought and for our discussion. You can take a look at the recommendations as well. Here you can see a map that is related to question 2, the question for the countries. How do you assess your country with regard to intersectoral coordination relative to One Health? You can see the various colors and the color code, and you can see how our region has the highest level of governance integration, but there are some countries in the region that are at the mid-level. C is mid-level, and elsewhere throughout the world, you can see how there has not been any progress. So I would like to invite you to peruse this map so that you can gain a greater understanding of the success stories as well as the primary challenges. Now let us move on to the outlook regarding resistance. Now, the Lancet article was the first input for the high-level meeting that was the UN high-level meeting that was held less than a month ago in September. And it was identified that in 2019, approximately 5 million individuals passed away around the globe due to causes related to bacterial resistance. In fact, bacterial resistance to antimicrobial, rather. Bacterial resistance to microbial components. Now, not all antimicrobial elements have the same level of resistance. We know that the fluoroquinolines and beta-lactamic antibiotics account for 70% of the deaths attributed to AMR for all pathogens. In other words, this article concludes that there are some antimicrobial elements that have a high level of resistance, and as a result, they are the first ones that the WHO recommends careful care for and isolation so that we may regain their therapeutic attributes, because many of these are crucial for animal and human health. The third conclusion of the Lancet publication is that the six major pathogens that contribute to the antimicrobial load for animals, humans, and the environment are listed here. Identifying the genes that are affected is also key. You can see the different bacteria or agents listed on the screen. These bacteria are also the ones the WHO is recommending that we focus on with regard to research, and that we maintain surveillance on these bacteria. Many of the mechanisms for bacterial resistance are new, and we're interested in identifying these so that we may make recommendations. So we have not seen improvements with regard to AMR, and that's why the leaders of the UN General Assembly met in order to address this matter. This took place on September 26th in 2024. In other words, just weeks ago, 2 months ago. And on that occasion, the leaders issued a political statement where they commit to a clear pathway forward with objectives and actions, including reducing or bringing down the number of human deaths related to antimicrobial elements, at least by 10% by 2030. In other words, our leaders set a goal, set a target, and a concrete pathway towards progress regarding AMR. Moreover, the technical secretariat was charged with monitoring and evaluating and following up on these measures. Stating as well that this quadripartite group or partnership will do that as well. So as I mentioned, the FAO, the UNEP, the World Health Organization, and the World Animal Health Organization are the 4 organizations forming this partnership in charge of monitoring, evaluation, and follow-up. We are all very pleased with this statement because it also provides these 4 international organizations with a roadmap for our activities going forward. This statement also contains several recommendations. Again, all of this is bound by the 4-area framework under One Health. First of all, one of these areas is human health, and the statement issued by these leaders says that at least 70% of the antibiotics used for human health, for human medicine globally, should belong to a WHO access group. In other words, there should be exclusive control and use of these antibiotics so that their effectiveness and efficiency will remain intact over time. In other words, the first message for human medicine is to carefully address these antibiotics and separate those that are proving to be resistant based on scientific proof. And there are other human health measures and targets with regard to infections. The statement also refers to key aspects related to sanitation in certain areas around the world where bacterial infections are more ripe. It also refers to hospital waste, mentioning that hospital waste, in fact, are a a key area for infections. Therefore, the leaders also refer to the need to better manage hospital waste and to continue pushing forward with infection prevention programs through 2030. With regard to governance, the leaders also request that the countries continue to assess and implement the national action plans, which are multi-sectoral. Now, the 4 organizations have also been charged with defining a global plan. If you recall, the first slide I showed you that referred to that. So the ICE to have a plan that goes through 2026 in order to have a solid, unified approach to AMR. And finally, there was formal creation of this quadripartite secretariat as the key group supporting AMR global activities. With regard to funding, there was a request for the countries to commit to sustainable financing and having correct budgets for the different activities under their national plans, and to address the gaps with regard to implementation. There is also a request to facilitate sustainable funding as well, and to facilitate equitable access and appropriate use to antimicrobial components, treatment, and diagnostics, and also request incentives and mechanisms to foster greater funding to drive research, innovation, and multi-sectoral development. So in other words, this involves a triad of the private sector, public sector, and academia. These 3 sectors are crucial in terms of this high-level statement. And now let me refer to agriculture and animal health. The statement issued by the leaders urges or requests the significant reduction in the amount of antimicrobial elements used globally in agri-food systems by 2030. In addition, they request prioritizing and funding measures to prevent and control infections while ensuring prudent, responsible use and proven use of antimicrobial medication in animal health. Moreover, the statement recommends that all of this be carried out within the context of priority diseases as defined by the World Animal Health Organization. Moreover, it refers to FAO's Reno Farm initiative. We'll talk about that later. This is related to good livestock practices, biosecurity at agri-food establishments, etc. So these are the different recommendations issued by this statement relative to animal health, human health, and agriculture. Moreover, the statement urges FAO and the other international organizations to work together and to draw up new guidelines to prevent and reduce the use of antimicrobial elements in agriculture, plant agriculture. And this is based on the Codex standards. With regard to the environment, the statement underscores the need to prevent and address dumping antimicrobial elements into the environment as waste. Moreover, by the way, the agency, this 4-party agency, is also working on a comprehensive user manual to address AMR and to address the ecology of antimicrobial elements. And we know that this is often related to biodiversity, and this is another issue of concern under One Health. And just to wrap up, the statement issued by the leaders also provides us with a roadmap forward. The leaders also request for us to make AMR more visible and that we surveil resistance as well of the use of these elements. Moreover, there's a recommendation to use the existing systems that the international organizations have made available to the members, such as FAO's InFarm, we'll talk about this later, and the GLASS system for human health and the ANIMUS system for animal health and other systems. The leaders also urge the countries to continue reporting on their AMR-related actions through the tracking system, through the self-assessment survey. The system is called TRACS. Perhaps my colleagues will post this link in the chat. Moreover, they provide analysis of the different challenges that were drawn from the country's self-assessments. They also issue a few key messages related to food and farming, specifically the need to have greater awareness and training among professionals, and how it's important to go from awareness to adaptation and behavioral change. And this is related to our current motto of acting now and promoting now. So we have a path forward, and in short, globally speaking, we need multi-sectoral actions at the global level in order to meet the 2030 objectives. And if we could summarize what the leaders are urging us to do, we could say they are calling for greater collaboration, coordination, and communication. Moreover, they are inviting us to act now. Therefore, this is an appeal to all of us to provide evidence and to have mechanisms as well as indicators to appropriately assess the effectiveness of national plans. I believe this is a very interesting appeal by this high-level panel, and I have provided you with all this information, and I urge you to join this large orchestra, and I will give the floor back to Nicolas.
Thank you, Alicia. Excellent presentation for the opening of this webinar. The message at the end of the three presentations, so we will have Q&A panel. So please write your questions in the YouTube chat pod and let us know who are you asking the question to. In Alicia's presentation, which was based, and there is a global framework, United Nations system based on solidarity among countries and transparency and communications, which are critical for these type of problems that affecting us all, no matter where we are. Thus, it showed that these global action framework is a state of the art and the main guidelines countries can follow. Therefore, innovation is executing this international agreement of measures through national plans. There is in this international solidarity framework, there are systems to make that information access transparent so that you can find the data wherever you need them. These data account for a real problem, a real issue, which requires wherever you are to do something, an intervention, not an individual intervention, but multi-sectoral. Therefore, data are reinforcing the need for this intervention. And in a way, like Alicia said, there is a clear state-of-the-art information that shows where are these priority lines countries can start working on what pathogens and antimicrobial should be prioritized, aiming at the ultimate goal, which is human health. And there are certain recommendations. So the next step is intervention of countries, that individual commitment that the United Nations system cannot force. Is a voluntary, but calls for this action, both collective and individual in every country. Alicia talked about or touched upon some of the topics of the next presentation. Germán Vázquez, who is our AMR specialist in Latin America and the Caribbean office, that will offer this framework called Renofarm. He will be explaining this, and this is a specific framework in the agri-food system in order to contain AMR. So stay tuned and ask those questions using the chat pod. And Germán, you are recognized, and thank you for your
Gracias,
presentation.
Nicolás. Buenas tardes a
Thank you,
todos.
Nicolas. Good afternoon, everyone.
Bueno, entonces, muchas gracias
So
por asistir
thank you
nuevamente a este evento.
for joining today.
Complacido de nuevo
And
poder
I'm
compartir
pleased
estas
being
iniciativas que se
having the
presentan a
possibility of
través de la
sharing
FAO
these
y
initiatives from
difundir
FAO
realmente
and disseminate
la comunicación y obviamente generar
communication and, of course,
concientización
build
sobre
awareness
el tema de
as
la
to this
resistencia a los
important issue
antimicrobianos.
of
Yo voy a hablar sobre
AMR.
un
I'll be
programa
talking
específico que
about
ha
a
generado
specific program
la FAO
from FAO
que se denomina Renofarm,
called
reducir la necesidad de
Renofarm,
antimicrobianos para
Reduce
la
the need of
transformación sostenible de
antimicrobials on
sistemas
farms
agrícolas.
for sustainable agri-food
Es una
systems
iniciativa
transformation initiative. This is an
que
initiative
obviamente está basada en la
that
problemática
is based
actual
on
que
the
nos
current
regula, que es obviamente
problem,
la resistencia a los
of
antimicrobianos,
course, AMR,
que obviamente pues tiene un impacto muy grande para la salud y para el
which has a
desarrollo.
huge impact
Para
on
la
health and
alimentación, la
development.
agricultura en
For
específico,
food and
una de las
agriculture,
consecuencias
particularly, some of the
se incluyen,
consequences
obviamente son los
included,
efectos negativos en la salud y
of
el
course, those
bienestar
are
de
the
los
negative
animales,
aspects in
la
in
menor producción de
in
alimentos,
health
la
of and
seguridad
well-being of
alimentaria
animals,
y
the
problemas
effect on
obviamente
food
relacionados
security,
con la
and
inocuidad
problems
alimentaria.
that have to do with the food
Asimismo, pues
safety.
las pérdidas económicas
The
que puede llegar a
economic
generar
losses as
esta
well
afectación
for
obviamente directamente
farmers
en el campo, en los animales y también obviamente en el ambiente,
and, of course,
ya que
on the
pues
environment,
puede llegar
because it may,
las bacterias en este caso
I mean,
y
bacteria in
o
this
los
case,
microorganismos
and or
que están siendo afectados, pues
microorganisms which
normalmente
are being
identificamos
affected
como principal peligro en este caso, pues
are identified as a main
los genes
hazard
de resistencia que se transmiten
because
por
of the
medio de las bacterias
resistance
y obviamente
genes which
ahonden
are
este problema.
shared by
Ellos pueden
bacteria,
establecer
which will make the
mutaciones.
problem worse. So these may be
Para eso,
all
pues la
over.
FAO,
So
dentro de
for
su plan de
these,
acción
FAO, as part of the action
de
plan for
2021-2025, pues tiene
2021
5 ejes,
2025,
cinco
has
pilares de acción que
five
obviamente están
pillars
relacionados con la gobernanza y,
to do with
y la
the
buena
governance and
asignación de los recursos,
good allocation
la
of
concientización y la
resources,
participación,
awareness,
como
and
pues estamos haciendo en este tipo
participation or
de eventos de
engagement. That's
difusión que
what we're
normalmente
doing today in
se
these
nos regula
dissemination
durante una
events,
semana que
even
hacemos de
though
concientización a lo largo del año se están
this
realizando
is
diferentes
a
actividades
week of
en
awareness, but
torno a
throughout the
temas
year we are doing a lot of
laborales
things
en
around
diferentes países.
AMR to support
Tenemos
countries.
obviamente la
We, of
vigilancia
course, have
profesional, vigilancia y la
surveillance. We have
investigación
to emphasize or
y
reinforce surveillance
fomentar
and
obviamente el
research,
uso
and of
responsable de
course,
los
to promote the
antimicrobianos.
responsible use of
Asimismo, se tiene
antimicrobials.
como
Also,
objetivo
one of the
muy importante
goals,
y
one
Alicia
of the
bien lo mencionaba,
priority goals,
todo el desarrollo
is the development
de
of
guías y aplicación
guidelines
de buenas prácticas,
and the
buenas
application of
prácticas
best
que obviamente
practices,
pues favorecen
which of course
la
will
prevención
favor
de la aparición de la
prevention
resistencia a los
of
antimicrobianos.
AMR.
Entonces, este programa, esta iniciativa
So these
de reducir
programs
la
or
necesidad de
this
antimicrobianos
initiative,
para la transformación
reducing the need of
sostenible de
antimicrobial
los
for the
sistemas
sustainable
alimentarios,
transformation of
se
food
generó a manera de
systems,
una declaración conjunta de multitud de
comes
actores
after a joint
China
declaration of
este año,
multiple
en abril
stakeholders in China in
específicamente.
April this year, actually.
Hay una serie de documentos que
series of documents which are already available in the web page of Reno Farm, which I will be showing you or sharing with you later. The initiative or product, if you wish, involves several strategies and methodologies for action based on clear and evident needs from the application of best practices. It's a globally demanded product to make agriculture and agri-food system sustainable. It considers the value chain and its strength and strengthening, supports in the extended collaboration and engagement of stakeholders, both under the approach of One Health. It favors the public-private association with the national, regional, and global agreements. The justification of the initiative is based, of course, in this multifactorial approach of AMR, which from the anthropogenic point of view is undiscriminated use of antimicrobials, focus on agri-food and livestock systems, which extends to the human component and also used in some cases in farming agricultural systems. So the existing prevalence of diseases, the lack of regulation and supervision on sales and use of antimicrobial and pesticides, control and forgery and of antimicrobial deficiency in the hygiene and biosafety management in agriculture and agriculture operations, anthropological factors, mobility, increase of population density, difficulties in medical care, among others. So there are several aspects that make a case for a plan or more comprehensive view to address this issue. Limited access to health and healthcare systems in rural areas for agriculture and livestock, deficient practices for animal well-being, the incorrect and the use of antimicrobials. For instance, the idea is to provide a comprehensive support from the field to the table to contribute to under the objectives of facilitating transition to healthier and sustainable agri-food systems, depending on the less use or lower use of antimicrobial, support the execution of the national plans of actions for AMR with a better inclusion and better management for the agri-food system, reinforce the positioning of agri-food system for managing a risk of AMR at the national scale through specific activities, and to move forward in the Agenda 2030 for Sustainable Development of Nations and SDGs. The initiative will make available a wide range of tools and resources that may be adapted to address the specific needs of countries. We'll build synergies with similar initiatives and we'll try to join with others that are around AMR. It focuses on improving best practices of production and will enhance the proactive prevention. Like Alicia said, strengthening preventive actions such as vaccination, biosafety measures, alternatives to the use of antimicrobial, reducing the need of antimicrobials, and guarantee a prudent and responsible use of antimicrobial elements. So to date, globally, we have around 237 members that have already signed this initiative. This is not necessarily as an organizational level. And as I said, we can have people from the academia, public sector, private sector, and as well as people, individuals. So this is not just organizations or groups and collectives, but also we can have individuals that can make a contribution based on their knowledge to address this initiative. So the structure of the initiative is through multiple actions, so to speak, lines of action. So one is the adoption of the five Gs or groups of benefits and the application of five accelerators of action that may drive sustainable progress or of such groups of benefits on agri-food systems. So-called accelerators are strategically designed to facilitate the adoption of prudent practices of antimicrobial use and mitigate the drivers of resistance. The idea is to shorten the flow of work and our challenging implementation and build synergies, always under the agri-food and sustainable system approach. This is an example which you will find in the Reno Farm webpage, showing all five benefits and the work streams providing support to primary production. Primary production as a whole, there is a work stream relative to agri-environment, another one, national enabling actions, and international enabling actions. Support is ruled by these five groups of benefits, where we have good sanitary or hygiene services to guarantee the access to good health services and the guidance on the prudent use of antimicrobial best production practices, what many of you are already familiar with. There are best practices for production for each type of productive systems. And what are agriculture best practices, livestock best practices, avian production, aquaculture best practice, and sometimes more specifically, or depending on the type of production, also the best alternative, good alternatives for antimicrobials. So that is optimum practices such as vaccines, reinforcing biosafety measures, alternative feeds and additives for feed, the comprehensive management of pests and biological control for those integrated management processes. The other benefit is to have good incentives to promote economic results and positive productivity in farming operations through rules and controls and good connectivity, building of networks by intensifying the connectivity among farmers to reduce their dependence on the use of antimicrobials and improve access to basic resources in their systems. Good example of a pilot plan in Indonesia in the avian chain. For each one of these benefits, for health services, increase the role of veterinarians in accurate diagnosis and prudent prescription of antimicrobials. Best practices, increased implementation of best practice in biosafety, vaccination, prudent use of antimicrobials, and best practices. Good alternatives promoted the production of eggs without antibiotics and the production of chicken, the so-called organic chicken meat, and of course the promotion of the alternatives to antimicrobials. Good incentives increase the official certification processes to expand marketing of products and improve the profit margins due to certification, which may have different subsidies that may be used for the different productive systems, and a good generation of networks with the increase in the approach and interaction of public-private alliances to mitigate the AMR in productive systems. So, as I said, we have five benefits and five action accelerators. So these accelerators are focused on education and awareness, social and behavioral interventions, assertive collaboration with the private sector and other stakeholders, research, innovation, new technologies, and involvement of the youth.
Bien lo mencioné en el cuadro
As I said
gráfico que presenté hace 2 slides. En
before,
relación a los ejes de apoyo y
as to the
aceleración,
support and
tiene
activation
uno que ver con lo
axis, one
agroambiental.
has to do with
En lenguaje se
agro-environmental,
favorecen
where
obviamente
we favor, of
estas
course,
cadenas de valor,
those
la
values,
interfaz,
change
las relaciones
the relationship or inner
humano-ambiente-animal,
human environment
y obviamente
animal
se consideran
interfaces,
estos
and of
mecanismos o
course
vías de
the
transmisión a la
mechanisms
sociedad.
of
En
AMR.
niveles nacionales, obviamente,
At the
todo lo que
national
tiene que ver con
level, all
políticas y
that has to do with
planificación
policies and
para
planning
las necesidades en torno a la RAM,
to
la
serve the
generación
needs
de
around
resiliencia
AMR,
y la
building of
transformación sostenible
capabilities for development and sustainable
y a nivel
transformation of agri-food
internacional,
system. At
pues
international level,
obviamente la generación de
of
estándares
course,
para
the
todo el
building of
trabajo,
standards and working
favorecer obviamente los ejes
frameworks
de
to
gobernanza e
favor
inversión y
governance
eso
and
es lo
investment
que se recomienda.
processes, a
Cada
dissemination
uno de
of
estos obviamente
knowledge.
pues
Each one
tiene
of
unas
these
estrategias
has a
adaptables de
number
acuerdo a las
of
necesidades de cada
strategies
región,
that may be
porque
adapted
algunos
according
países
to the needs. Some
requieren más
countries
énfasis
may require more a
en
greater
aquellos
emphasis
componentes que
on
manejan a
some of
nivel
these
nacional,
aspects at the
otros
national
en
level,
relación, por
or
ejemplo, a
as to, for instance, the agro-environmental
entonces,
components.
Renofarm en
So
general
Reno
ofrecerá
Farm will
procesos
offer
de hermanamiento o acompañamiento y
processes
cooperación con
for
otras
supporting
iniciativas de
cooperation with
FAO, que
other
son la
initiatives
FED,
by
como les
FAO,
decía,
such as
alianzas público-privadas,
public-private
programas de entrenamiento y
alliances,
capacitación ejecutiva,
training
soporte técnico en
programs, technical
transferencia de la
support
FAO,
with the FAO reference
plataformas para
centers,
compartir
platforms
conocimiento,
to share knowledge,
herramientas que obviamente están
tools, of
diseñadas
course, that are being designed or that
esta
have been
iniciativa,
designed to apply this
servicios de
initiative,
asesoría y soporte a miembros,
consulting
y
and
oportunidades para
support
programas
services to members
comunitarios.
and opportunities for joint
Entonces, las
projects.
consideraciones para la
So
participación y
for
trabajo cooperativo
participation and
para
collaborative work
Renofarm,
for Reno
pues
Farm,
obviamente pues
of
se tiene
course,
ese enfoque de país de
require
acuerdo a las
this
necesidades y a las
countrywide approach
capacidades y
according
demanda
to
de la
the needs
actividad.
and capabilities that may be
Normalmente,
built.
como les dije, la
As I
participación
said,
dentro,
engagement or
dentro de este
participation
network, dentro de esta red que se puede
as
generar,
part of this
pues
network that is
puede
being
llegar
built
a ser a nivel individual
may be even individual or up
organizacional o
to
colectivo.
organizational level or collective
Pero
level.
normalmente, pues ya
But
cuando se
when
van a ingresar a participar, digamos, las
when
personas gerentes,
you
pues la
want
idea
to
es hacerlo a
officially
través de un
join, the
proceso de
idea
conversación
is to do it through the country FAO
Los
office.
participantes podrán participar, como les
Participants
mencioné, se les
may
guiará, pueden actuar dentro de estos
interact
diferentes ámbitos
within
enfocados
different fields
de acuerdo a su
or
capacidad y en el
scopes
momento
according to their
favorecido.
capabilities and whenever they want
Entonces,
to do it.
aquí está
So
obviamente pues
this
un
is
código QR
a
para
QR
los que
code.
quieran, lo dejo en un momento y de pronto
Well,
más
I will
adelante
leave it on the
a través
screen for a
de
while,
nuestro
and
chat
then through the chat
se
pod,
podrá compartir el mismo para
we
aquellos
can
que obviamente
share this.
deseen
And for those who would like to
unirse a esta iniciativa,
join
que
this
por el momento
initiative,
obviamente
which
no tiene
for the time
ninguna
being
obligación de un
is
vínculo, un compromiso
no,
específico más
this
allá
is not
de una, un
a
compromiso
binding
local, sino que
agreement. This
obviamente
is just an
simplemente
expression
pues
of
para generar
will,
capacidades y
the
ser parte
commitment to build
de la
capabilities
solución o
and
la
to be part
problemática
of the solution
RAM desde un
to
punto de
these
vista
AMR issues
preventivo.
from the preventive
Entonces, aquí
standpoint.
está
So
la página, como bien
again,
les mencionaba,
this is
ustedes
the
pueden
web
acceder
page, but
al registro a
you
través de
can
este link.
always join using
Esto era
this QR
básicamente
code. That
referente
is the
obviamente a
presentation I had for you. Once again,
los links para el registro y bueno, les
the
agradezco a todos
registration
y
links,
pues
and thank
en
you,
la medida que
everyone.
ustedes puedan
And
incluir esta
if you can
información o acceder a la página web de Renofarm,
access to the Reno Pharma
irán
web
obviamente
page,
empapando más de la iniciativa,
you will
porque como
learn
les digo,
more
pues
about the
ya se
initiative,
está
which, as I
haciendo
said,
y ha tenido un grado de
is
impacto
already underway, and that has shown some
significativo.
impacts in some
Les agradezco
Eastern
mucho
countries.
y
So
bueno,
once again,
le
thank
dejo,
you.
Nicolás.
And
Gracias.
back to you,
Muchas gracias,
Nicolás.
Germán. Gracias por la presentación. Les recuerdo, estamos
Thank
capturando
you,
las
Germán,
preguntas que
and thank you for
tengan
the
con
presentation. I would just like to
la
remind you that we
referencia
are gathering
enlace al
all of your
desarrollo. Les pido que
questions.
responda en el chat de YouTube. Ya estamos recibiendo preguntas.
We are
Así que
receiving
el próximo
questions
módulo
from
que
the
correspondería
audience. And following Maria's presentation, we will have a Q&A period. So Germán brought us to another level regarding the presentation, referring to global governance and how it involves different tools and the RenoFarm technical framework. RenoFarm is a systemic approach that refers to FAO's 5 objectives and turns these into good practices in the 5 areas he referred to. Now, the idea is to work at the level of behavioral change and good practices. It is undeniable that it is necessary to coordinate and work under one health. This concept of one health is the coordination itself. So the sectors need to sit down at the same table and discuss the country level priorities. RenoFarm is an accelerator, and it facilitates the state of art of what a country can reach and what a country can do with regard to aligning its national plan with global governance and align with in keeping with technical guidelines that have been agreed to by experts globally. Therefore, innovation is about action. So you have access to the technical content that will aid you in designing your interventions as a means to contribute to this governance. To contain AMR in your countries. RenoFarm is a voluntary initiative, and Germán closed his presentation by referring to how it provides access to individuals and institutions from the private sector, public sector, civil society, etc., so that they may all work together in a coordinated global fashion regarding One Health and the containment measures. This is yet another step forward towards greater visibility and to collaborate under the One Health concept at a regional, national, and global level to contain AMR. Again, please be sure to access this content and figure out what grain of salt you may add to all of this. There is no limit in terms of the date to join this activity. Now, let me give the floor to Maria de Los Angeles Gatica, the regional coordinator on AMR in LAC, and she will refer to the more specific work regarding data collection and information management. This is all key for gathering information related to AMR. So, Maria, the floor is yours. Thank you.
Muchas gracias, Nicolás. Bueno, muchísimas gracias por la invitación.
Thank you, Nicolás. Thank you for the invitation. It's a pleasure to be here with you, and I'm pleased to be celebrating the World Antimicrobial Resistance Awareness Week. As Nicolás mentioned, during this presentation, I will focus on AMR surveillance as well as AMR data and information management. Just some general context. When we start looking into the best approach or the best way to tackle AMR, what we begin doing is assessing the various international guidelines and literature available out there. We've heard about the Global Action Plan, for example. That was when the leaders defined that AMR is actually a threat to public health, and that's when they began defining key areas of action in where key technical and political parties, authorities should begin working. And FAO also developed its own action plan for AMR. We're actually now engaged in the second edition. I'm not going to delve into the details of each plan. We've already heard information on these. But I would like to mention that both guidelines, documents, consider research and surveillance as key components for addressing AMR. And this is precisely what I'm going to focus on now. So what is surveillance? What is AMR surveillance? According to the FAO definition, surveillance consists of the systematic and continuous collection, validation, and analysis of data, as well as the timely dissemination of information to stakeholders, especially those in a position to act on these matters. Now, if we look at the Codex definition, it's essentially the same, but it adds something else. It says that this is the basis for risk analysis, and these data may allow measurement of the impact of risk management measures taken by the different stakeholders. Therefore, surveillance, as you can see on the screen, involves multiple stages, each of one containing its own complexities and critical steps, such as planning, sampling, sending the samples to the laboratories, analyzing these samples under strict quality control standards and international standards, gathering data, data analysis as well to obtain information, and then said information will be issued to the decision makers as a way to guide their management activities. So in order to support the countries with regard to designing and implementing the AMR surveillance plans and with regard to how to best use antimicrobial substances, there are some international guidelines. For example, the HMO document. There is also a standard, the document referring to the standardization of national AMR surveillance and follow-up programs. And then there's the Codex Alimentarius, the OMSA document, or rather the WOAH document, and then there are also documents issued by the FAO for monitoring and surveillance of antimicrobial resistance in bacteria from healthy food animals intended for consumption, and then USAID guidelines, rather FAO and USAID guidelines on monitoring antimicrobial use at the farm level and others. Alicia referred to tracks. Tracks allows the countries to self-assess, and then this information is launched, uploaded to the tracks system. This provides information on the agri-food systems around the world. On the left, you can see the National Surveillance System for AMR in live terrestrial animals. On the right, you have the same thing, but live aquatic animals. Then we can see that we have made progress with regard to AMR surveillance programs, but we still have more to do. The issue is more important on the aquatic animal side, where we need more action still. Here, we have some information referring to the level of implementation of surveillance systems and plans under an integrated approach. You can see where the countries either answer yes or no, and there's still a great deal of progress to be made in order to include this collaborative approach with animal health, plant health, human health, and to expand the approach to all the necessary elements. Now, despite the fact that we have seen progress in the different countries in keeping with the data submitted by the countries, I would like to show you the other side of the coin. Here you can see in red that there are still countries that, despite saying that they do have AMR surveillance plans, the plans are not necessarily using the best information relative to antimicrobial use. So there are many reasons why this may occur. There may be a lack of a proper data collection or management system. There could be issues related to data quality, other issues related to surveillance actions per se. Perhaps there is a lack of proper definition of responsibilities at the different surveillance units. Maybe in some of the countries, all the agri-food AMR surveillance actions are in one ministry, and there's a fragmentation, or maybe there's a lack of capacity among the personnel. There are many reasons why. Perhaps there could be there may not be an information dissemination system. Maybe the information is stored but never disseminated or used. Again, there are multiple factors that need to be taken into consideration. What is important to underscore is that despite the fact that we the speaker's audio suddenly went out. In any event, there's a great deal of data not necessarily being used for decision making. Now, let me refer to where we can be more effective. Really depends on our objectives or different surveillance domains: animal health, plant health, food safety. This is focused on public health or passive surveillance. And if we're focusing on sick animals, that involves certain actions. It really depends on what we're doing. You have the WHO that constantly gathers information from the countries on AMR, or perhaps we can go a bit further and obtain farm level data relative to the antimicrobial substances being used. Again, we can look into feed waste or food waste. So we already know what surveillance is, but now we need to know why surveillance is really important. Well, it's about the data. Why do we need data? And generally speaking, the data from any surveillance system provide information on the scope of AMR or the magnitude or how the antimicrobial substances are being used in our production systems. The data also provide us information on waste, and this allows us to know what types of antimicrobial substances may be in the food. The data is also key for identifying changes and trends related to AMRs, the agents per se, or on certain resistance determinants. We may need to address new methods, or we may need to conduct further research on the microorganisms. Moreover, data allows the countries to identify and manage their risks and to act before the problem gets out of hand. This can be carried out. This is applicable to the global and national levels. So the data provides us information for issuing early warnings and identifying risks in time. We have some graphs that show the trends with regard to different production systems, the increase in AMR and LMICs, that's on the top. And the same study shows another map showing in red, where you have the higher levels of AMR. Asia, for example, has a higher level, but in Latin America, we can also see some hot spots with a greater level. And this clearly provides us with an indication as to where we need to focus our attention going forward. Now let me provide you with some information with regard to overuse and misuse of AMR. You have information on the left from an EFSA study showing how the consumption of several antimicrobial substances has an impact on final products. Let's not just focus on the negative, though. If you look on the right side, you can see information on how, well, these are the results of after having applied measurements for appropriate use of antimicrobial substances in livestock during the course of nationwide action. Moreover, data and information provide support for better distribution of resources, a better definition of interventions that we should implement, and how to best evaluate interventions. We need to make sure that our interventions are timely and country-specific. Interventions may also be global in nature. Therefore, it's important for the countries to share their data on the global platforms currently available and that we have already referred to here today. We also know that the countries are constantly facing multiple challenges. AMR is not the only challenge the countries face. So these data are important. They're key. They provide us with, they shed light on where we need to focus our attention in the future and in the present. This information will also help us to determine what are the critical antimicrobial substances so that we may define our awareness activities, awareness raising activities. This also allows us to prevent infections before they arise. Now, this is also key for veterinarians and all the different parties involved so that they know what's going on at their farm level to make sure that their treatment protocols are appropriate or not. It's important for the farmers and veterinarians to conduct susceptibility tests so that they will also have data, local level surveillance data that will be useful for their decision-making needs. And data gathered over time through surveillance systems are key for assessing the impact of interventions already carried out. I already referred to some examples, and we know that data are essential to let us know how well we are doing and if we're having the desired impact or whether or not we need to adapt or correct our actions so that our outcomes will be as expected. So regardless of the level, global, farm, or national, data are essential because they enable us to know what's going on, why what's going on is going on, and what we can do to make changes and to measure what we're doing. And this will allow us to better understand the resource we have available and apply these appropriately. At FAO, we have a commitment to support the countries with regard to capacity building relative to AMR surveillance. And that's why we have provided them with support on planning. We have worked in the field directly. We have strengthened laboratory capacity as well, so that we can ensure that the laboratories provide quality data. We have also focused on having laboratories work at international standards for comparative purposes, so we know how well we are doing vis-a-vis other regions. We also know that technical networks have been formed, and we have some manuals available as well. German talked about Farm, which is something that FAO is promoting. I wanted to refer to other FAO tools and an actual platform that is being developed and that is launched this year regarding data management and information systems. The first tool that I would like to refer to is FAO's Atlas surveillance module. As you can see on the slide, surveillance entails different stages and involves critical elements that go above and beyond simple data collection and management. But that is one of the key components. So in order to meet the surveillance objectives at the global, national, and farm level, you need to have a surveillance plan as well as a surveillance system that enable us to have updated, comparable, representative data and top quality data as well. We know that that is extremely complex and challenging as well. That is why FAO has developed this tool called Atlas, which specifically focuses on that. on laboratories' capacity, assessing it, and assessing surveillance systems. And since it addresses surveillance systems, it focuses on different components such as governance, for example, on how the countries are actually gathering the data that they are generating and how the countries are developing their data, how they're assessing them. Moreover, the sustainability of these systems to make sure that they remain intact over time so that we may address the trends over time. And of course, we want to assess the actions being implemented. Another key component here is how all of the information resulting from said analysis is being communicated. Because as I mentioned earlier, having a great deal of data is fine and dandy, but it's not very helpful if the information doesn't reach the decision makers, either at the political or technical level. And there's another component that I wanted to refer to, which I mentioned early on, and this is FAO's International Antimicrobial Resistance Monitoring Data Platform. This is what we call INFARM. We've mentioned this several times because we want the message to be loud and clear. It is important to use the data, and FAO has made an effort to support the countries at every level in terms of implementing the surveillance plans. And FAO realized that using data and interpreting data and communicating said data involves different steps, and there are gaps in some of the countries regarding these steps. Therefore, FAO began working on this platform, which essentially has a twofold objective. One is to provide support to the countries with regard to data, MAR data use, collection, and analysis regarding food and agriculture, and then support the countries willing to publicly share AMR data from the food and agricultural sectors for global surveillance as a public good for international advocacy and action against AMR so that we can all join efforts. So this platform has been under development for a few years, and this year was the first year that an open call was made to all of the countries to engage and to upload their data. And this this call is open until December 15th this year. Here we have a bit more information on InFarm. It's important to remember that this is framed by the coordinated efforts carried out by the organizations for integrated AMR surveillance. Now, each of the organizations will make its own contribution to surveillance through this system. So we have the different organizations. WHO will be working through the GLASS system. We heard about that. That is where it's gathering information on AMR and AMU. And then we have the World Organization for Animal Health that has made significant progress with regard to gathering AMU information on a yearly basis. And then we have FAO through InFarm, which will focus on AMR in animals and food. And also, InFarm is developing a component on antimicrobial use in plant production and protection. So as I mentioned, all of this information has been uploaded by the organizations working in a coordinated fashion in order to have an integrated approach to AMR and AMU.
These are in the map that countries have different progress levels in the implementation of these surveillance programs, and that is seen here. So countries have the opportunity to provide information at a pilot level, pilot projects that could have would be national or also from surveillance programs that already have a national representation. And requires context information, how systems, surveillance systems are structured to gather more information and better understanding on data interpretation. And after adding this data into the platform, countries can analyze this data and build a series of charts, trends, absolute values, among many others, that will help them in the preparation of their national reports on MAR, therefore reports that they will have to disseminate among them stakeholders, and countries will make a decision as to how confidential their data will be. It could be a private interface, which is a level 1, countries that use the platform. They upload their data, and of course, they can interpret their data, but those data, nobody else will have access to. This will not be shared with the global system. And there is a second and a third option. It's the same. Upload data, analyze data, download the charts, the resulting charts. But the second alternative, countries say, I want to share my data, but I don't want to know who I am. Therefore, data are aggregated at the regional or global level, or in a fully public open interface. The country says, I want them to know who I am. I don't have a problem with that. FAO will encourage second and third level so that we can support global antimicrobial resistance surveillance. What are the benefits of INFA? This is a safe place where to store data with restricted access. Specific key persons can access to it. Encourage countries to build more data, quality data, and strengthening the capabilities of the surveillance system. It's a safe, easy to use tool to analyze and interpret data, can have trend analysis, identification of emerging MAR, improves the coordination of a collection and analysis of data, and standardization in the building of the generation of data so that everyone can work together. It builds information to disseminate among key stakeholders, but also information for design, implementation, and monitoring of interventions, which are, of course, contribute to the global efforts and surveillance of AMR under the One Health approach. So in summary, surveillance of AMR and MAU includes processes from design and planning all the way up to dissemination of information and, of course, the analysis of measures implemented. This should be comprehensive. We cannot just keep the first step, but we have to disseminate information. We have to make we have to make available what is happening to the many stakeholders and what's the path forward. Then quality of the data is key for risk analysis and properly guide interventions. And these data are important at the global level for early warnings, long-term trends. At the national level, will guide the decision-making, risk management, proper and timely interventions. And at the local level, will guide the decision-making on treatments. And all those involved in food production in order to guide local actions. And the last message I want to share is that data are an opportunity and not a threat. We know that facing data it might be challenging, but without knowing what is happening, it's difficult to implement uh, actions which are relevant to our problem. So let me encourage each and every one of you, your industries, sectors, work, or jobs, to encourage the use of data, to use the data, generate data, but also sharing this data at an international level so that actions are at all levels. So with that, thank you very much for your time and attention and invitation to share this information with you. Thank you, Maria. That's an excellent presentation. The data are an opportunity. That's what you said. And without data, there's no management possible. We need to understand that without data, you're managing hazards. That means you can monitor, and intervention needs to be monitored on the product, on the outcome, not on the impact, and hence the importance of that data. Maria shared the importance of that data generation with a system-wide view. Once you have the data, you have to share it, to analyze it, and share that with all those involved. And that is One Health. On the other hand, she made clear that even though progress has been made, now We need to share data now at a global level, but clearly what we see is that FAO has tools and the expertise. Atlas as a monitoring tool, and for the identification of opportunities in the surveillance system, or the in-farm that can extend this global information. Just a couple of examples. Now, the biggest message here, the key message is the data collection. It's a continuous improvement process. It's a model requiring a gradual approach, regardless of the current situation or the starting point. The point is to build data to improve public policies as far as the MAR. What matters. Data are not ghosts. Data are the best ally in terms of understand the problem and to manage it. Managing answers means opening the opportunities in terms of policies. Data will allow laser-focused interventions, which are required for these multi-cost, multifactorial problems, where you can make an intervention wherever it is cost-effective and in the limitation of resources everywhere. Intervention based on data allow for that search for effectiveness intervention. That's where Maria de Los Angeles made an emphasis on just the work on data. It's one of the big pillars of MAR. We have 10 minutes left. And we have a set of questions now that we're asking the chat bot. Put some context to them in order to simplify answers. FAO intervenes from cooperation projects. We do not have intervention in countries nor an influence unless requested by the country. For this, the UN framework makes for countries to build a 5-year plan to prioritize intervention areas. And from that, on an annual basis, the country where the relevant areas and the country offices will put together a prioritization list for the year. And then the country will request FAO's support. Therefore, it is critical to have a requirement, a demand, so that FAO can assist from the generation of a project, mobilization of resources, and expertise support in implementation of the tools. One of the questions is how to build synergies between One Health and MAR. It's quite simple. MAR is One Health, a work under the framework of the National Commission, and the national plan is a One Health paradigm. So it's just have to join. Maybe the big challenge of this call for action is the engagement from the different sectors. Without engagement, without participation, there is no change in the dynamics of MAR. Some questions ask, what's more important in multifactorial issues or problems? We cannot say what's more important. This is a system. And more importantly, we need to see the whole system within the framework of this intersectoral approach as part of the national policies, and then define priorities where you can be cost effective to start this gradual improvement. And then it is clear that the country, with their own decisions, have to try to better understand the local context. Data are critical. Setting of policies and awareness and the training of stakeholders is another one. Governments, as agents of governance in a territory, they cannot do magic without the different working without the different stakeholders, public, private, civil society. So the call for action of these type of problem is there is no policy possible without the commitment of the stakeholders. Let me ask a question for Germán, telling what is the best intervention to educate in the framework of primary education in the rural context, and together with how can we how can we have a better intervention where the strategic vision of a behavioral change of stakeholders clearly in farm provides for an umbrella approach, but there are other lessons learned. Is there a magic receipt as to think of training and awareness in the country, Germán?
Bueno,
Thank you, Nicolas.
al respecto, pues igual diría que el
Well,
abordaje es
I would say that this is a multidisciplinary. I mean, it could have different ways to address this.
creo yo que una
I
oportunidad, obviamente,
guess
cuando se
this
intenta
is an
abordar el
opportunity
tema
when
como
you're
se hace
trying to
en
address
torno a RAM, ¿no?
the
Porque hay mucho por
communication
hacer
around
actualmente.
MAR. There are lots to
Yo
be
me
done,
basaría
and
sinceramente es principalmente en los
I would
principios de
use
comunicación
the
del riesgo, ¿no? Aquí estamos
risk
hablando
communication
de un
principle.
riesgo
This is a
específico, o sea,
risk-specific
así en todo
risk,
como la RAM,
uh,
pero que obviamente tiene una
but
serie de
with
determinantes,
the
¿sí?
multiple
O derivadas,
drivers
¿sí? Entonces,
and
obviamente
derivatives.
se aborda
So
desde todos
MAR
esos aspectos y
is
desde múltiples
addressed, is dealt
sectores.
with
Lo
from
importante es
different
que obviamente
sectors,
haya
from
un
different elements.
involucramiento de todos los
The
actores que
importance is
participan
the
en un
engagement of all those
proceso de
stakeholders
seguimiento. En
in
este caso,
a set
pensamos
process. In
normalmente
this
nosotros
case,
en las
we
cadenas agroalimentarias
focus on
y en
agri-food
ese sentido, pues
chains.
obviamente está la comunidad
Thus,
rural y
we have
obviamente todo lo
rural
que incluye
communities and
ese marco rural. Entonces,
everything
cómo
that's
llegar a
within
ellos,
this
pues
rural framework. So how to reach
es
them? Well,
un
that
principio y es un todo, o sea,
it's
no
a
es solamente
principle,
pues
and
con
that's a
algo que
whole.
digamos en este
Not
caso pues
only the
desde la RAM,
hazard, the
sino
risk of an
ese
MAR,
énfasis de que lo que
but
se
also
está
an emphasis on
promoviendo,
that
por
that
ejemplo,
what we're
a ellos muy
promoting, for instance,
notablemente
among
es
them,
a través de las buenas
that
prácticas,
we do
pues eso
this
tiene un
through
impacto
best
directo sobre
practices,
esa RAM.
that will have a
Entonces,
direct impact
no
on
es solamente el
MAR.
hecho que la
So
RAM
it's
es un
not just the
peligro y
fact that
que
MAR is a
nosotros
hazard,
llevándolo
a
de los manuales
risk,
estemos evitando la RAM,
and
sino
with
que
that we were
se
solving the
requieren
problem.
obviamente
No,
acciones
we need
para evitar esos
actions in order
determinantes de la
to
RAM o esos
avoid this,
generadores o
to
impulsores de la
prevent
RAM,
those
como lo decía
drivers
ahorita
of
la
MAR,
presentación,
as I've
pues
shared in my
deriven a
presentation,
incrementar esa
will
problemática.
lead to an
Entonces,
increase of the problem.
acciones sencillas como
So
conocer
simple
los
actions
principios
such
básicos
as
de un buen uso
knowing
de
the
los
best
antimicrobianos,
principles
que
of
idealmente deben estar
antimicrobial sources
formulados por un
that
ayudante
will have to
veterinario, por alguien que
be
conozca,
formulated by
conocer, por
a
ejemplo, la importancia de
veterinarian,
llevar un
knowing
registro
the
de
importance
cuándo
of
se
keeping
utiliza
a
un
record of
medicamento
when
veterinario y
use
por
a
qué lo
certain
utilizamos.
veterinary
Es
drug
una
and
acción
why.
fundamental y
And
básica.
that's a
Ahora,
fundamental action.
no me
Now,
centraría solamente
I
en
would
eso,
not
¿no? A veces
focus only on
para el
that, as
agricultor puede ser
for
complejo, obviamente,
farmers may be a
implementar esto y
challenge to
obviamente pues igual hay una
implement
serie de
this
incentivos
without an
o de sobre
incentive,
todo a pequeña escala
or
y en esta
especially at a
región,
smaller, a lower
si no
scale
hay
in
una
our
serie
region, without a
de
series
incentivos
of
o compromisos, digámoslo
incentives or
así, de
say
la cadena de la flor
commitments
para beneficiar
from the
obviamente
chain in order to
a este
benefit
productor.
these
Por
producer
último,
or
diría que
farmer.
una
And
oportunidad
last
muy
but not
grande que
least, it's a
actualmente de pronto
huge
no se
opportunity
utiliza y que obviamente le
that
llega a todo el
uh,
mundo y
that
creo que lo aprendimos un poco
I
a
believe
partir de de la
we've all
experiencia COVID,
learned from the
obviamente
COVID
la
experience
difusión a
that
través de los medios, ¿no?
dissemination through
Medios
the media
digitales
and by
que hoy en día
digital,
obviamente
by
casi
that
que
I mean
cualquier
digital
persona
media that
llega a tener.
almost
Entonces, así
anyone
como
can have today. So
bombardean, digámoslo así, con
uh,
información
we received
superflua,
tons of
diferenciada,
useless
igual hay que llegar a
information,
generar
but
campañas
we
muy
can build
específicas para,
campaigns, specific campaigns,
no sé
in
si
order
mencionar
to,
la palabra
I don't
bombardear
know, is the right word, but
generar mucha
uh,
información a
build a
todos
lot
estos
of information
consumidores ávidos
and
de
reach all
información
those
con
consumers that
mensajes claros,
are looking
importantes
for this
en
information
torno a
with
la
clear
microbiología.
messages around
Entonces, esta
MAR.
información
So,
normalmente pues
well,
llega a
this
personas que pueden
information
llegar a
will
utilizar
reach
este tipo
people that may be
de
using
aparatos
this type of
desde los,
devices. I mean,
pongamos, desde los 15 años
I don't know,
hasta
from the
edades
age
muy
of
avanzadas
15
también.
all the way up to a
Entonces,
senior age.
creo que hay una
So
oportunidad muy grande
I believe we have a
para
big
llegar a
opportunity
mucho.
here
Importante
to
tener
reach
principios
many.
claros de
The important
comunicación del
is to
riesgo
have good
que puedan
risk
llegar y que
communication
obviamente
principles,
la idea no es asustar,
and the
como de
idea is
pronto
not
sí
to
nos llegaron a
scare
asustar
people,
durante el tiempo
as it was
COVID,
the case
sino
during
que esto es
COVID.
algo que podemos
But this
trabajar
is
entre todos
something
y
we
podemos
can
llegar
work to get. We
a
can work
avanzarlo y a
on
programarlo y a diseñarlo.
together, and
Importante
we
como lo que
can
decían de la flor,
schedule, we can
la
plan.
comunicación
We need the engagement of
con base en el riesgo
stakeholders risk-based communication and the use of multiple dissemination activities or alternatives. Thank you, Germán. And let me emphasize Germán's message that here there is a need to change message, to translate the technical message to everyday language. Hence the need of behavioral change of stakeholders is to be done through the strategic view of the local dimension, with the idiosyncrasy, the local culture. Hence, this communication cannot be based solely on technicians, on experts. This needs to be managed with the sociologists and under the approach of understanding social engineering. This interdisciplinary work, it's One Health, and that's the big challenge, using idiosyncrasy or local culture to maximize the impact of these communications efforts. One of the questions is, what are the lessons, the most important lessons learned? First lesson learned we have to date is that efforts made to date have not allowed for reversing the trend in the evolution of MAR. So what we have done, even though has not meant a substantial change, hence the need for the commitment, not from the inability of addressing this system-wide problem, but the minimum interventions, smaller interventions can change the evolution of MAR. And here, again, a question for Maria. With these lessons learned related to data, what priorities in terms of monitoring and evaluation can we have as far as this data collection in the global system?
Prioridad a nivel global, sistema de datos global.
Global priority the priority here is to acknowledge that every country is doing something. They're collecting data
Lo que tenemos,
and
¿verdad?
organizing what we have.
Cómo,
I mean,
¿qué nivel de
uh,
representatividad tienen estos datos?
how representative
Finalmente es lo mismo.
these
Proveer
data
datos
are,
para
and
datos que están
promoting
siendo
that these
generados, ¿verdad?
data which are
Copiados.
being generated
Hemos
are
visto
actually
que
used. We've
efectivamente
seen over and over again and again in many countries, regionally and globally, these data
en escritorio,
are
en escritorio.
kept in a drawer
Y es
and
necesario
on the
que el
desk.
componente técnico,
And
¿verdad?
the technical component
Levante un poco más la voz.
maybe should speak a little
Estos
bit
datos son tan
louder to
importantes
say that
que
these
tienen que
data
llevarlos,
are
¿verdad?
important, that they have
Analizarlo y
to
comenzarlo, ¿cierto?
take
A
the next
transformar desde
step. We
inicio.
have to
Y en eso,
analyze
la
and
verdad es que va a ser
submit
un
it to
proceso
decision makers,
avanzar
and it will
y
be a
complejo.
challenge
Así
to
es,
move
¿cierto? En
forward.
cada una de las materias
Countries
que
will go
tenemos.
blind without this approach.
Muchas gracias.
Great,
Y en
Maria.
aras del tiempo le voy a dar
And one
participación a nuestra
last
colega Alicia.
question for Alicia. Same question. From the global view, what are the lessons learned? Can we think of, in this, from the positive standpoint of wasted data to the multiple stakeholders engaged in this MAR effort? It's we need to acknowledge that the problem it's difficult, and we have multiple solutions. We need innovation, and probably the key component is behavior. A behavior of all of us. I mean, people working on agriculture, technicians, our leaders, maybe behavioral change. I mean, it's something we have failed. We have spent a long time, and we haven't been able to manage this integration referred to by Maria de Los Angeles, that we have page integrated everything. The first thing we have to think is, and the good news is that with integration of information, both use of antimicrobial as well as resistance from all stakeholders, led by human health and then multiple interfaces. We have several interfaces that we have no data about. So once we have that tool available with the guideline, with the standardization of techniques and everything, of the systems. Well, the second recommendation, which also is lesson learned, is a risk analysis, both interfaces and sectors, and eventually prioritize intervention stages. The other lesson is that we cannot do everything. Authorities, agencies, so that we have to prioritize because that's critical. Maybe there are certain sectors we do not see, and efforts should be focused on them. So the way forward is positive. I mean, this type of meetings where FAO is taking the leadership, inviting this collaboration are key to, again, I like this concept of an orchestra, but this school fish, we have to work everyone, all of us should work as a team. Thank you, Alicia. I love this orchestra concept. Well, this is the end of the webinar. Couple of final message. The certificate may be downloaded at the event's website. Recordings will be made available in this website. Like to think we have over 100 people joining from the region and a couple of countries from Europe. Remember to sign in hashtag One Health FAO. FAO Americas to be part of the next webinars. This was the third webinar out of 7 for 2024, 2025 around One Health. So for next year, we'll have 4 more that will allow us to understand and work together with this One Health view. We hope this webinar was useful, not from the encouraging of not from the with that, but for the to the motivation to individual talk. Revolution of stakeholders with a positive view. I mean, leave our zone of comfort to find this change that will contribute to the common well-being. One Health and MAR is making us face that. Remember that we're here to help you find the best way to make or to pave that way, that path to improve containment of MAR in Latin America and the Caribbean and around the world. Thank you, everyone, and have a good day.